kind of that concept or feeling that I'm normal, that I'm a normal kid. Just because I have diabetes doesn't mean I can't do things. So it was learned.
Roughly 64,000 Montana adults have received a diabetes diagnosis in their life. That's about the population of Helena and Butte combined. When someone's diagnosed with diabetes, often they need a hospital stay, and that can average about 4 days and cost $25,000. That's how much a brand new Toyota Camry costs. Thank you for joining us on today's episode of Talking Health in the 406, where we're one community under the big sky. I'm Jennifer Van Sickle, your host, longtime healthcare worker turned health educator, and I'm joined today by Melissa House, type 1 diabetes survivor and double organ transplant recipient. She also happens to be the manager of the Montana Diabetes Program. Welcome, Melissa.
Thank you, Jennifer.
Great. So, Melissa, before we get going, one question we have to ask. Butte pasties. Ketchup, gravy, or nothing on them?
Ketchup and gravy.
Oh, I was not expecting that. I am a ketchup-only person. Okay.
Depends on the day.
Oh.
And you got to throw a little butter on top.
Oh, my gosh. I love it. I love it. That's my next pasty. I'm doing all three. Ketchup, gravy, and butter. Beautiful. So, Melissa, Butte girl, you were raised in beautiful Butte, America, and you had kind of an interesting childhood. So, tell me about life, your young years. Active, healthy kiddo? How was that?
Yeah, I grew up in a very active family. We were always outdoors, camping at the lake. Huge family togetherness. I mean, we did everything together. So very, very active. I twirled baton, and it was great because I got to travel around the state. For part of the time growing up, every summer I lived in Great Falls at my coach's house with several different teammates from Billings, another one from Butte, two from Helena. So yeah, always active, always moving. Never had time to just sit.
Awesome. And then at some point in your childhood, life kind of threw you a curveball. Can you tell us about those days leading up to that and how that was?
Yeah. So I remember I was young and really didn't know what was going on, but I could drink like a gallon of water in 10 minutes. And then it was like instantaneously I needed to run to the bathroom. And it was like nonstop. Drink, go to the bathroom, drink, go to the bathroom. And in the evenings, I would have severe leg pain. And my parents just thought it was growing pains, right. You're doing a lot, shin splints, things like that, because it would go away. It wasn't all the time. And it was just getting worse, as the time go. I remember coming home from Boulder, from doing a clinic and having to stop at a friend's of my grandparents' house in Elk Park so I could use the bathroom. I couldn't really even make it from there.
And that's about 30 miles from Boulder to Butte, so less than 30 miles.
Right.
Wow.
Yeah, so it was just, it was kind of crazy. I remember I was in the 5th grade at the time, and, my parents just thought, oh, it's growing, things are changing, I'm active, doing a lot of things that, that's kind of what was all involved in, what was going on. So really didn't think anything of it. And I can remember it like it was yesterday. My mom had made a doctor's appointment for me to get in, and all I cared about, because it was a Friday, all I cared about was that I had a sleepover planned for that night. Mm-hmm. And I just wanted to, it was a birthday party of one of my classmates and friends, and that's the only thing I was concerned about. I did get to miss school that day, though.
And so you went to the doctor. Did you go to your pediatrician or to an Express Care? What did you do?
It was Express Care at the time in Butte. And of course my mom knows everybody in Butte. So it was like, bring her in. So we went in. I really didn't know what was going on, running tests, doing a lot of different things. I was, again, just like, okay, can we get out of here? Let's go. And all I remember is, I don't really remember much of what they talked about. But I remember we left the doctor's office and we went to Dairy Queen.
Oh gosh. Did you have your diagnosis at that time?
I did.
You did.
I did.
You had just been diagnosed with diabetes and you went to Dairy Queen. Oh,
yes.
Yeah. And
yes.
I had ice cream, I imagine.
Oh, yes. Oh, yes. Had ice cream. And it was funny because, that was, oh gosh, let me do the math now, how long ago that was. I mean, that was 30 years ago.
Yeah.
Diabetes at the time wasn't something that was really talked about.
Yeah.
It was, people had it, people knew of people that had it, but it wasn't a big conversation starter. It wasn't something that was brought up in a lot of conversations. So I had no clue what it meant.
Yeah. And kudos to Express Care. A kiddo walks in the door and they had the presence of mind to test you for diabetes. Granted, you had one of the biggest symptoms of frequent urination, but we hear these horror stories on how subtle diabetes can show in kids and how it can be overlooked by so many physicians. Things like irritability, stomach ache, starting to wet the bed all of a sudden out of the blue can all be signs of diabetes. And thank goodness they were able to catch that. And so then tell me about life after that diagnosis. How did you even learn how to deal with this new world that you were suddenly put into? Where did you find help? What did you do?
Yeah, it was kind of crazy. It was a whirlwind. And like you said, with the diagnosis, it can be so different. For me, it was textbook. And I think that was one of the easiest things for them. It was textbook symptoms. But it was crazy. Like I said, it was a Friday. I was disappointed because I couldn't do the sleepover and we kind of had to figure out. So went back to the doctor and spent the rest of the day there learning, really learning about what was next, what were the medications, what was, the care, what all that looked like. One of the things I think growing up in Montana, small towns, my nurse from my doctor at the time, from my pediatrician, lived like a block away from me.
Very nice.
And because it was the weekend, I went over to her house. I learned how to check my blood glucose levels. I was able to go over there. They put me on insulin, of course. And she was able to help me learn how to do insulin injections all by myself. So for the first probably 2 to 3 weeks that I was diagnosed, I went to her house every morning, every evening, and it was awesome. I got that one-on-one attention with her, and she kind of helped both my mom and my dad and I through that initial process. And it was a learning curve for everybody because, again, it was, what is diabetes? We don't know a lot about it. So it was definitely a learning curve. And being a kid, how do you fit that into
absolutely
what a normal fifth grader's doing?
Birthday time in class and somebody brings cupcakes to school. How did that affect your life?
Yeah, and it was different than it is now because you didn't have a lot of options. So, it was like, do you miss out on all of that? Halloween, with all of the sharing of the candy and all of that kind of stuff. And there was a lot of unknowns at the time. So it was like, can I have a piece of gum? Can I have something, And my mom and dad were really good. They let me participate in everything. So I got the candy. I brought candy. I was able to share. But then it was like bringing it home. Here you go.
Oh, yeah.
And I am not going to deny, did I sneak candy at times? Oh, yeah. It was like, nobody's looking. I'm going to take a piece, an hour later. Chocolate's my favorite still to this day. So, I had that going. But yeah, it was very different in learning how to handle all of those situations.
Yeah. And thinking back, can you think of any other unique struggles that you had that the average person wouldn't even consider? We're aware of, no candy, no sugar, but what if you did have to go to a sleepover? What if you wanted to go out on a hike? What can you give us some insight on what a person with diabetes might be facing and struggling with?
Yeah, and I think it's very different for kids. And, as kids are diagnosed, it's that struggle of trying to fit in and still be, kind of that concept or feeling that I'm normal, that I'm a normal kid. Just because I have diabetes doesn't mean I can't do things. So it was learning. I was very into sports and things when I was growing up. And like I said, I twirled baton and all of that. So it was trying to manage that, manage how I felt, like how my body felt when I did different activities, and what that looked like. Was I having a low blood sugar? Was I having a high blood sugar? Fitting in timing of when I had to take my insulin and what was happening during that time, and really having to take the time and pause, making sure that I always had snacks. So it was hard. I mean, it was really difficult just trying to be a normal 10, 11, 12-year-old and then fitting all of this extra stuff in. And learning about food. I think that's something that everybody really doesn't understand. And,
Absolutely.
As a kid trying to, you can't eat this because of the carbohydrates, or you can't have this, or, try this. But I was very fortunate to have an amazing family. My grandma took it on. She was a baker and took it on to, I'm going to try anything and everything. Pies, cookies, cupcakes, cinnamon rolls. She found a way to make them so I could enjoy them as well. So Great. It was just, a lot of learning, and a lot of being afraid.
Yeah.
Sleepovers were different. I can say probably for the first year, there was only 1 or 2 friends that I could sleep over at their house. One was because her mom was a nurse, and the other, they were just close family friends. So, my mom knew it was comfortable. Yeah.
So if you were diagnosed today, if you were that 10-year-old 5th grader, what recommendations, how would things be different? What recommendations do you have for families out there today who are facing a diagnosis, whether they're in 5th grade or whether they're 50 years old? What do you have to recommend?
Yeah, I think things are very different from when I was diagnosed to now. Again, it was kind of a very taboo subject at the time. So when you were trying to find help, it was very individual. So, finding a dietitian or finding anybody like that, it was
you're on your own.
You're on your own. Mm-hmm. And there were resources out there, but I think today, and, I hate to say this and not in a negative way, but in more of people today that are diagnosed, I think are a little bit more fortunate because of the services and things that we have, even in Montana. We have a lot of programs and resources. There's a lot of support groups. There's a lot of activities for kids. We have diabetes self-management education and support programs across the state. And the thing about it, even though we have all these services, 42% of Montanans still are not accessing any of these services, and they're great resources. So, if I were to say one thing about, what you need to do if you get diagnosed today, don't be afraid to reach out for help. Ask your provider, ask friends or family members, get that support system, and, reach out to the local healthcare systems and providers, because there are a ton of resources out there, whether it's in person, it's online, in a group setting. There's just lots of opportunities out there. And to be your own advocate, I learned through the years that you can't always count on somebody else to point you in the right direction. Sometimes you have to count on yourself to get you to where you need to go.
Absolutely. You need to ask questions to really find the right answers. And,
yeah.
Yep, absolutely.
Yep.
And at our website, diabetes.mt.gov, we do have a map of all the diabetes care and education specialists in Montana. And if one is not available locally, I know telehealth is throughout the state, and given the recent pandemic, there's been even more telehealth options, and dietitians, you name it. There's always somebody there to help. Absolutely. Perfect. Well, Melissa, thank you for joining us today. And patient advocacy is key. Asking questions. Ask your provider, ask your family, ask your friends for help. And just know that you do have access to diabetes care. So thank you for joining us on this episode of Talking Health in the 406. Remember to take care, neighbor, because we're one community under the big sky.